Hassan.
So hi everyone. So it's just Bryce here, Program Manager for London ADAS. Can I first of all, so on the call we've got a number of providers and we've also got a number of our single points of contact, our SPOCs. I wanted to start off with saying, as of Monday of this week, you will have been aware that the double running of the Market Insight tool and capacity tracker ceased as of 10 a.m. and a letter was sent out to everyone. The aim of this session is to ensure all providers and SPOCs are fully clear on the process to enable you to add the data to the questions. The vast majority of the questions are not new. They've just been migrated from the Market Insight tool. So I think this is not about the questions, it's about the process. I just wanted to really start off with, can I just say to everyone, can we give everyone a massive round of applause for the wonderful work in London that both providers and SPOCs have done for the last number of months in supporting the sector through an international pandemic. So can we do a big round of applause from everyone? So hopefully with that in mind, Hassan, over to you to take us through the process.
Chris, Sanjit, is there anything you want to say before I start?
Can I do a couple of key messages, please, Hassan?
Yes, please.
Cool. So first thing to say is that this webinar will be recorded because a number of people couldn't attend. So we will put the recording on YouTube and send the link round in the next couple of days. It's only a 30-minute webinar, so we probably won't have time to take questions verbally. But if you have questions, you can either put them in the chat box with your email address, or you can email them to my email address, which I'll put in the chat box, and we'll get back to you in the next couple of days. And there's also written step-by-step guidance, which shows in detail what Hassan's going to talk about. And I'll put this in the chat box at the start and the end. So that's all the key messages. Thanks for attending, everyone, and over to Hassan now.
Thanks, Chris. Just a quick request, Chris. Could you just mute all, please, so then we don't have any background noise?
Yeah, I'll do that right now.
Thanks.
Okay, everyone should be muted now. So if you unmute yourself, and yeah, okay, go.
Thanks, Chris. So yes, as Chris, Sanjit, and Tristan have mentioned, I work for North of England Commissioning Support Unit. We're the NHS organisation that deliver the capacity tracker. My role is to support the London region with completion, adoption, and any issues that we have with the capacity tracker. So we did have a previous masterclass a couple of weeks ago even, where we kind of ran through the capacity tracker, how to complete and how to keep updated with the capacity tracker. So as Tristan mentioned, London ADAS and Next have been working together to try and ensure that there's only one tool that you guys have to complete. And we finally got to that point. I know we've been waiting for this for some time, but we've finally got to that point where you only have to complete one tool, and that's a capacity tracker. So what we've done is migrated the Market Insight tool questions over to capacity tracker. So I'm just going to run through what that looks like and how to complete the questions. So I'm just going to share my screen, and hopefully you guys can see that. Chris, are you able to see it?
Yep.
Perfect. So when you first log into the capacity tracker, it will look like this. This is what your system will look like. Just a reminder that the first thing you will see when you log in to the capacity tracker is this pop-up box. This pop-up box will tell you the most recent update in capacity tracker. So just keep an eye out for any new messages that come up here. And you can dismiss them by clicking on "Don't show this again" or the cross at the top. So this is what your system will look like, and these are the tabs that are available to you. Up until now, we've been asking everybody to update their vacancies and business continuity information using this first tile that's available here, and that's a business continuity and vacancy update. Because there's been a bit of a change in the system and the fact that there's more questions for the London region only, we have to employ a slightly different system and process for completing this information. Like Chris has mentioned, there is a slide deck, and he'll drop it in the chat box for you to access later on. And if you do have any more queries, feel free to speak to your SPOCs, or Chris will also put his contact details in the chat box. So the first step that we need to complete is clicking on this heart-shaped tab. So it says care home providers, setup and details. So not the lightning bolt anymore, but the heart-shaped with the ECG line going through it. So if you click on that tab, it will take you through to your care home. I'm just mimicking one of the care homes in London. So it will take you through to this page. You might have seen this before when you first registered for the system, or previously the process was this one. So you may have seen this page before. So you've clicked on the heart tab. The second step is to click on the business continuity. So there's a clickable button here which says business continuity on it, and it's underlined when you hover over it. So if you click on that one, it will take you through to the next screen. So just a quick overview, it will look slightly different to what we had before. So it's still within the same kind of boxes and the same themes that we had previously. There's just a couple more things to complete. Okay, and we'll just run through them quickly now. So the admission status and overall status, that's staying the same as it ever has been. That's not changed. But one question that has been added at the top is the number of self-funded residents. And that's just a box that you can type into just to kind of include the number that you do have that are self-funded in that area. And then scrolling down, so these are the questions that were added at the end of July. No, not the end of July. I think at the end of June, sorry, for COVID-19 recovery. So the previous questions are still there. So the overall number of residents that are suspected or confirmed in the care home, any newly suspected with COVID-19, and any residents newly confirmed with a lab test. And there's a couple more additional questions for residents now. So these are the top three that have been there from the start. So total number of residents with COVID-19 either suspected or confirmed in the care home currently. Any residents today or since the last update. So there's been a bit of a change, or since the last update, that are suspected to have COVID-19, and any newly confirmed with a lab test today or since the last update. So the additional MIT questions are around, again, COVID-19. So the number of confirmed COVID-19 positive residents that were admitted from hospital today or since the last update. And same as the other three, if you click on the box, you'll be able to complete whatever number that is. Okay. And then any confirmed COVID-19 positive residents that were admitted from the community. So the first one is hospitals. The second one is community. Again, that's today or since the last update. And the last one around that is the number of new admissions to hospital related to COVID-19. So any of your residents that have been admitted to the hospital due to COVID-19.
Hassan,
Okay.
Claire would like to ask a question.
Of course. Claire, you might have to unmute yourself.
Yeah, I would like to ask a question, Susan Williams. Sorry. On the on this part, the admissions from hospital, the issue we seem to have is we also admit from the community, but there's no question about that if they're negative.
Okay.
You've got a positive from the community,
Yeah.
new admissions from hospital relating to COVID-19, negative from hospital, but not one from the community. So our numbers could go up and down, but it doesn't get reflected there in as, you know, with the history. I just wondered.
Tristan, any reason for that?
So that's one we can pick up, Susan, okay? Because we're already being criticised for having too many questions. And that could be...
Oh, sorry. Well, perhaps then at the bottom, could you have a box that we could just, you know, put our, you know, anomalies in? That would probably be the best.
Susan, I think that would be perfect. Is that okay,
Yeah.
Hassan, in terms of an action?
Sorry, there was a bit of an echo.
So Susan came up with an excellent solution. We're having a box at the bottom just for any anomalies in terms of what you submitted. Is that right, Susan?
Yes, I feel that.
So if we could add that, Hassan, as an action, that would be appreciated.
Yeah, if you could keep a log of that, Tristan, and then email it through to me.
Thank you.
Okay. Claire, do you want to unmute, or are you still struggling?
No, I'm fine. It was pretty much what Susan just said. So yeah, that's fine. Thank you.
Perfect. Great minds. Great minds. So yeah, as Susan and Claire mentioned, the last one is around negative residents that have been admitted from hospital. And that's today or since the last update. So we've got positive from hospital and community, new admissions to hospitals related to COVID-19, and any COVID-19 negative residents that have been admitted from the hospitals.
We were just saying, sorry, we were just thinking that if some of the residents, some of the clients are coming from the community, could there be a box to say unknown, that their status is unknown?
So, colleagues, this is a really interesting topic.
Because if they're coming from home or from their own home, they might have a COVID. They might have a COVID test a few weeks ago or a month ago. So, and then automatically you would isolate them for 14 days anyway, and you would take swabs on the first 24 hours and the next 72 hours, and you send it off. That's normally is the process. So why can't we just have a box that says unknown if they're coming from home?
Okay, you can leave that with me, and I'm going to liaise with provider colleagues in terms of getting the wording right. Is that okay? It's just that we're going to eat into our 30 minutes. Yeah.
Fine.
Well, I've logged it as an issue. Is that okay?
And just to kind of say, if there are any more queries, Chris is going to keep an eye on the chat box. So the chat box on the right hand side, if you hover over the screen, there'll be a little message icon. If you click on that, you can include any of your queries, because this is a really important opportunity to hear any feedback as well. So please continue to put your queries into the chat box. Okay. So just to finish off on these questions, are residents tested for COVID-19? Yes or no? These are clickable boxes. And the number of residents tested, that's either today or since the last update. So not the total number, that's today or since the last update. The last two boxes do not need to be completed. They automatically populate from what's been inputted at the top. Okay. We also have some historical questions around staff, so newly suspected and newly confirmed COVID-19 today or since the last update, so they're historical capacity tracker ones. The additional MIT ones are around staff testing. So are they being tested, and the number of staff that are tested, that's again today or since the last update. And again, just a gentle reminder around the outbreaks. So it's 2 suspected or confirmed, or it can be one of either, within the last 14 days counts as a outbreak. And once you have an outbreak, it's declared closed if there are no further confirmed or suspected cases after 28 days. So that's a Public Health England definition. And that, if you do have an outbreak, it will pop up in here. Again, you don't need to complete anything here, but it will auto populate in this section if you have had an outbreak, how long it lasted, if staff were involved or residents, and whether it's still open or closed. Okay. So moving on from the COVID-19 questions, the next section is a workforce. So again, there's the original capacity tracker questions with some additional MIT requests. So just the categories: how many people are employed by the care home, by the establishment? How many of your staff, full-time equivalents, are absent at the moment? Do you need any additional staff? We'll go through these 3 first. So again, historically we had either clinical staff or non-clinical staff. We just have a couple more categories now. So in terms of clinical staff, we've got that split into nurses and care providing staff. We then also have, for the non-care providing staff, we have the total number of non-care providing staff and how many of those are managers, cleaners or others. Okay. And then separately, we have a question around agency staffing. So what were your numbers like for pre-COVID agency staffing, and how many agency staff are you using currently? So just a reminder, this is the total number of staff employed. These are the total number of full-time equivalents that are absent at the moment, and if you require any further staff, just split into care providing and non-care providing staff. Okay, and then a separate 2 boxes around agency. And again, the historical workforce status, so green, amber and red. Again, just a reminder, if you're unsure what these RAG status mean, if you do hover over them, they will give you the background around what that RAG status means. Okay. So we've gone through COVID-19 so far, workforce, and now we'll come on to PPE. So again, we've got the historical questions around the RAG status for capacity tracker. That again has not changed. And again, just a gentle reminder that if you hover over them, they will tell you roughly what that means. So for example, red means we've either already run out or going to run out in 48 hours. Just a bit of a heads up, there is a plan coming from the national team around changing the RAG status to again just ensure that we can monitor whether you guys have the right amount of PPE, and that's come from Public Health England. So this might change over the next couple of weeks, but again, it won't be a big change. If there is anything that you're struggling to understand, just hover over the box and it will tell you what it means. So for example, red means 2 days or you've run out, amber is within 7 days, and green at the moment is we're doing fine. Okay.
And Hassan, from a London
Yeah.
perspective and a SPOC and supporting provider perspective, the key element here, colleagues, is around the days of stock remaining and the days required per day. You have been filling it in, brilliantly over the last number of months, and we don't want to lose that because it's really helped SPOCs in terms of the support they've been able to give you. Is it okay?
Yeah. So as Tristan mentioned, these are the additional questions on the right-hand side. So continue filling in the RAG rating and then the number of days you have stock remaining and how many roughly required per day. Okay, and that's required for all of them apart from eye, face and protection. In terms of the additional MIT questions that Tristan just mentioned, there are additional questions around goggles and face shields. Because it's not a capacity tracker question, an original one, that's not a national ask, you don't need to complete a RAG rating, but for London region, you do need to complete the number of days stock remaining and how many you require per day. So how many goggles are you going through per day? And then lastly, the number of disposable face shields that you have. Okay. And then I think these are the only 2 questions that we have now in capacity tracker that are required to complete some text. So the first question is around if any of your key supply chain are affected by COVID-19. So if you're struggling to access anything in particular around PPE, whether that be masks or hand sanitizer, etc., if you pop that in there, again, like Tristan mentioned, your SPOCs will be able to action that and hopefully try to remedy that issue for you. And just below that, is there anything else that you need to let your SPOCs, your local authorities, your CCGs know about your PPE requirements? So is there anything that you're struggling with at the moment or anything that you feel that you need that isn't covered in the above question? So they're just free text. Again, you can just tap on the box and just complete free text information. Okay. And the last question we have that's additional in the PPE section is around hand sanitizer. So the question is around the quantity and size requirements for any hand sanitizers that you have. So again, this is, you can type information in there and the number that you need. Oh, I think I've just broken it. It's good to test, isn't it? So yeah, sanitizer, how many you need. I think I just put too many numbers in, and the size that you need. Okay, we have been told about an issue today where you're only able to add, so you're only able to add one 100 ml and you're struggling to add anything else. Oh no, you can. You can. Okay, so I've got one 100 mils at the moment, and say I need 2 500 ml. You just click add there, and then if you need to add anything more, you add sanitizer there. Okay, so just to recap, in terms of PPE, you've got the long-standing RAG rating. We have some more questions around days of stock remaining. They're clickable boxes that you're adding numbers. How many required per day? A rough number of disposable face shields, and then some free text around your supply chain and any other questions or queries you have around PPE. So just a recap, we've gone through COVID-19 questions, additional questions about residents and staff, workforce, so how many non-care and care providing staff, just a bit more detail around that, and agency, and then the availability of PPE. The last question we have that's additional for MIT is visitors. So can friends and family visit the residents on site? If you click yes, then you'll just get a bit more, another pop up. If you click no, then it won't come up. If you click yes, there's some more questions around where they can visit and PPE requirements. So where can they visit? Is it outdoor, indoor, bedrooms and bathrooms? And are they required to use PPE? Okay. And then if they're required to record the name in the visitors log, how many have you had in the last 24 hours or since the last update? So since you last updated the system or in the last 24 hours, same as the the COVID-19 questions, how many have you had? Okay. And hopefully you keep a log, relatively easy. You just check in the book that they're signed. So if you click no, there won't be any pop-ups that come up. If you click yes, there's just clickable buttons to say yes or no. Okay. And then the number. So again, just final recap, we've got COVID-19 questions, number of self-funded residents at the top as well, COVID-19 questions for residents and staff, workforce, so additional questions around the type of care staff and the non-care providing staff, and agency, additional questions around PPE, the days stock remaining required per day, some free text boxes and add sanitizer, and the last one around visiting. The step that some providers are missing, which is kind of coming up as providers not having updated their system, is just a quick reminder. These are the infection prevention control questions. They don't need to be completed if you've completed them once. Although, again, just another heads up, there are national conversations happening between the NHS, Department of Health and Public Health England around some additional questions being added to this section. But you'll be happy to know they'll be taken off this page. There will be a different page that will come up that will have these questions. There's still some conversations going on around how regular that needs to be updated and the types of questions. But it's just to watch this space. So you don't need to do anything.
Hassan, from a London perspective, the expectation is all these questions will be completed this week. It's 13 questions within the infection prevention and control measures. So please, colleagues, ensure they're completed this week. And then following that, there's, as Hassan says, there's the communication as to the frequency of the different questions.
So is that if you haven't completed them before, Tristan, or if
no, we would like all providers just to review and refresh because things may have changed. So the guidance is if things haven't changed from your last submission, then there's no need to update. But we would really, really value your time just to have a quick check and see and make sure that your responses as were are the responses as is.
Okay. There you go. That's a London request for you. But like I say, again, on the front page, there will be a pop-up that will tell you if anything changes. So as I was mentioning before, one of the things that we continue to see with some providers is that they're spending the time completing the tracker, but they're not coming down to the bottom to save the details. We've raised this with the developers for Capacity Tracker, and they will be hopefully putting in some save buttons further up as well. But please, if you've completed all this information, and you get to this point and you think you've completed it, please continue to scroll down and click Save Details. Otherwise, it will just come up as if you haven't completed any of the information. So please scroll down to the bottom and click Save Details. I'm just going to come out of this just because I've changed some of the information. So we were in the Business Continuity tab. So we've completed the information. We've clicked Save. The next point we need to go to, once it saves, great. So because there's a change in process, and again, I will just quickly flick through it again, I'm conscious of time. We have business continuity information and we have vacancy information. They both need to be completed on a daily basis. So this is business continuity information. To get to the edit vacancies tab at the top of the page, so no matter how much you scroll down, it will stay at the top of the page. There is an edit vacancies button on the top right. So if you click on that button, it will take you through. Hopefully this looks familiar. It will take you through to this section of the vacancy information, where all you need to do is complete the box where you have any changes in the vacancy information. If you don't have any changes, just hit save again, and it will just make sure that it says that you've updated. Okay, I'm just going to do a really quick recap of what I've talked through, just for any late joiners. So this is what your screen looks like when you first log into the capacity tracker. They've historically been telling you to use this lightning bolt tab. That's the first tile on the screen. But now, because of the change in the additional questions, we're asking you to click on the heart-shaped tile instead, which says Care Home Provider Setup and Details. If you click on that one, it will take you through onto this screen. We click on Business Continuity. And again, complete all the information that we've talked through today. Please click Save. Make sure it saves. Give it the time to save as well. Once it's saved, you click on Edit Vacancies. There you can complete your information for your bed types, the number of beds that you have, if anything's changed. If nothing has changed, just click the save button. It's as simple as that. Chris will share the slides. They've also gone to your SPOCs and your SDP leads, so they will slowly be coming through to you via the CCG and your local authorities. So your borough representatives will be sending them out to you as well.
And Hassan, to remove confusion, could we just not remove the lightning bolt box, as Jennifer says in the chat? Because it's super confusing to go in when you're a busy provider and have 4 tabs, not knowing that it's the second from the left that you have to click, or making it really explicit. Please click here.
I think the challenge is, so the hope and the idea is, this is just a temporary fix until we can get all the information back on one page. Because this is just a London ask and not a national ask, it's just thrown the system out a bit, actually. So this is just a temporary fix. As soon as we can get it all back on, all the information back on one screen, we'll go back to that process just to make it easy for providers. So that's the reason it's still there.
Excellent, thank you.
Chris, do you want to just say a couple of words and just include the information on in the chat box? Just before I go, just to echo what Tristan said earlier, we really appreciate the effort that you're putting into this, and we sometimes get messages coming down from the national team, and we get a lot of feedback around how much effort the care homes are putting into multiple systems that you have to deal with. We understand the challenges around the testing system and the capacity tracker, but stick with it, because the information is absolutely crucial. It's going all the way up to the Prime Minister's office with this information. That's how crucial this information is. So thank you for all your hard work. This is absolutely crucial. Off you go, Chris. Sorry, you've got 30 seconds, I think.
That's okay. Thanks very much, Hassan. Thanks so much, everyone, for joining. I've tried to put the slides in the meeting chat. I'm not sure if it's worked or not. So if it has, then download them from there. If not, then we will find another way to get them out to people. This meeting has been recorded, so we will send a YouTube link round in the next few days. And if you have any questions, please put them in the chat box and with your email address, and I'll get back to you in the next couple of days. Or you can email me directly. My email address is chris.larkin, that's LARKIN, 2@nhs.net. If you email me, I will email you back in the next couple of days with a response. So thank you very much for joining, everyone. Great to see such great attendance, and we'll see you soon. Thank you. Bye.
Thank you.
Thanks, everybody.
Thank you.
Thanks a lot.
Thank you.